And moving on to the next question, how do you think COVID-19 or like other respiratory infections, how do they affect like our long-term lung health?
That is a very good question. And I'm going to be a little technical, but I'll try to simplify it as much as I can as well. So, human beings all think that when we are born, when a newborn baby is born, the baby has really, really good lung function, which is true. But the maximum lung function that a child achieves or a person achieves is usually at the age of 18, because your lung function keeps going up and up and up as you get older and bigger and taller, because obviously your lungs have more space, more alveoli tend to open up. Um, the problem with viral infections is that we are born with a set of genes, but environmental factors can affect the way your genes are expressed. Does that make sense?
Mm-hmm. Yes.
What that means is, just because you're born with a certain set of genes, that doesn't mean that genes get to determine how you will be 10 years, 20 years down the lane, because when you get exposed to stuff, those tend to change the way your genes are expressed. Some genes may be more expressed in relation to what you are exposed to. Some genes may be suppressed. Whereas some latent genes which are not active in your parents may be more active in you because you were exposed to something that your parents were not, even though you both share the same genes. So that is the science of epigenetics. Viral infections tend to change two things. One, they tend to change the way your airway lining behaves. When you have a viral infection, what it does is it infects the lining of your nasal mucosa, also the windpipe mucosa and your bronchial mucosa. And that mucosa is nothing but tiny amounts of cells which are sitting side by side, side by side. And when those cells are affected by the viral infections, they get destroyed. Some lose their function. Whatever they were doing when they were healthy, they don't do. And because of that, at the same time, we all get exposed to dust and pollen and animal hair, and that is part of normal life for us. Normally, these lining cells were keeping you safe from all the things that you were getting exposed to. But when you have a viral infection or when you have an acute illness, you may be exposed to stuff that you are normally exposed to, but your body is not keeping you safe from them. So you tend to react more. A lot of times when people have a viral infection, for a year, maybe even few years afterwards, they behave like asthmatics purely because of this phenomenon. So, in the same way, when you talk about COVID-19 or any other infection, it can change the way your epithelium behaves in a temporary part of your life, but whatever you get exposed to at that time can affect your lungs in the long term also. When you talk about COVID in particular, if you have a particularly severe form of COVID pneumonia and you have something called ARDS, acute respiratory distress syndrome, in which your lung has a really bad pneumonia, you can heal in one of two ways. One way is your lung gets rid of all the inflammation and pus and you are left with healthy lung tissue. But the more common phenomenon is you end up with a lot of scarring inside your lungs. And that can lead to long-term lung restriction, as in the capability of you to exercise as much as you were before you had the infection may be going down. And it depends upon the severity of your lung infection. It also depends upon the way your lung heals up after your infection. Does that make sense?
Yes, sir.